Queensland is extremely multicultural. There's a need to prioritise multicultural Queenslanders as an audience, considering the different health barriers, communication barriers and system barriers that they face when accessing the health system. The Multicultural Health Engagement Project exists to understand those barriers more and their needs in the community. We've been working for 2 years on the project to further identify the needs, test a co-design approach model that's been developed with communities and roll it out across the whole of the department. So everyone is co-designing with communities in their own way. So service providers, just like Centacare, are very embedded in communities in Cairns. So by partnering with them on a project, we're able to see the best outcomes possible, build trust, credibility, and also authentic partnerships with the communities in Cairns.
I think the co-design project that's being proposed and the model that's being proposed is really exciting because I think it goes beyond ticking a box. It's actually asking for community feedback at an individual level, and it's asking for different communities to have the confidence to say, yeah, this might work, or actually this could work even better for our community if we do X, Y, and Z.
And here in Cairns, we've been able to have 2 workshops, one with our bicultural workers who are working in Centacare, and through the help of Centacare, we've been able to meet community leaders, community members.
It was a really great presentation from the department of the progress in the model and explaining it. And then was a little bit of testing ground. People start participating, giving input, teaching us a lot about what that model will work in their own communities.
This is also a good way for us to be able to raise our voice, what we don't understand and how to navigate the system.
Then it's not only for me, it's for my community as well, because I get the knowledge from today's event and I can share this knowledge to my community.
It also reflects back to what we're facing or what we're going through. I find it's very important, the message that's passed on to us.
My parents, for example, don't know how to speak English, but they live here, and it's important that they also understand it in a way that they can effectively able to voice what they want, rather than us children, for example, who think that we know English better than they do, making decision for them, and they're capable of making that decision, but the barrier is language.
What I can see from this whole experience is getting communities excited that they're a part of a process of change, and change for the better, and that it won't happen overnight, but the more we invest time into this space together in an authentic partnership, we're going to see effective change for future generations. I think that's exciting to be a part of.
I think that co-design can work very well in the community. Really, I appreciate it, and I come out with different bright ideas that I can reflect to my Muslim community.
We were able to test the co-design in the most effective way with some really unique communities that we'd never been able to reach before, and we wouldn't have been able to reach without the help of Centacare.
I think what was really exciting was seeing such a mix in the room that also included people of different cultural backgrounds and people of different faith backgrounds. When we get informed through diversity, we really have to have a holistic lens. And by having different people from different faith groups, they were able to inform us on how that impacts health literature and dispersion in migrant communities.
Genuine and authentic change within the health system. This is just the first step, the tip of the iceberg when it comes to working with multicultural communities across Queensland and potentially across Australia as well.
I really hope that in the future, what we've learned from this project so far, whenever government have engagement with communities, this is the principle that they should follow to really have that meaningful engagement.
We said lightly, we said every day, you see it in the news, that this country is a multicultural country. Let's be it. Be multicultural. Let's really accept each other. We are all different, and it's the beauty of here, yeah? It's the beauty of this country. Let's be it. Let's embrace it in every process, yeah? In every process, let's be multicultural.